In this video, we'll go over 5 common causes of shoulder pain, so stay tuned and keep watching till the end. Number 1. Rotator cuff tendinitis and bursitis. Rotator cuff tendinitis happens when the tendons in the rotator cuff, the group of muscles and tendons that surround the shoulder joint, become irritated or damaged. While it is often assumed that a certain pattern of activity caused the problem, more accurately, age-related degenerative changes within the tendon predispose the tendon to become damaged with normal daily activities. Similarly, rotator cuff bursitis occurs when the bursa, or lining that provides a cushion between the bones and the tendons, becomes swollen or irritated. This process usually occurs as a response to the underlying degenerative process within the tendon. The two are usually closely related and can happen at the same time. Usually rest, ice and anti-inflammatories can help treat these rotator cuff issues. Number 2. Rotator cuff tears. The same overuse that leads to tendinitis can lead to rotator cuff tears. Eventually, the chronic inflammation and degeneration can cause the tendon to wear down and tear. The pain of a tear is more of an aching or throbbing discomfort that can interrupt sleep. Physical therapy, anti-inflammatories and/or steroid injections can help treat rotator cuff tears. If symptoms are severe, surgery may be an option. Number 3. Arthritis. Patients can experience intense shoulder pain as a result of arthritis as well. Many people have never had a documented injury or trauma to their shoulder area. It's important to look at the patient's history to determine if there were any injuries that may have gone undiagnosed. Otherwise, a fair amount of people can experience shoulder pain due to arthritis without any prior injury. Number 4. Frozen shoulder. This condition is one of the most popular culprits that brings patients with shoulder pain. Frozen shoulder happens when there's inflammation in the lining of the capsule of the ball socket joint. The shoulder capsule thickens and tightens, which creates the discomfort. There is no known cause of frozen shoulder, which presents as progressive pain with motion and stiffness. Treating frozen shoulder usually involves performing exercises to expand range of motion. Sometimes, doctors use numbing medications and corticosteroids. A small percentage of patients may benefit from surgery to loosen the joint capsule, allowing it to better move. It's unusual for frozen shoulder to happen again in the same shoulder where it first occurred, but people can develop this condition again in the opposite shoulder. Number 5. Calcific tendinitis. Like frozen shoulder, there's no identifiable cause for calcific tendinitis, but it can be quite painful. Calcific tendinitis is a condition where calcium deposits build up in the muscles or tendons. They can be seen on an X-ray and are typically more common in people who are over the age of 30 but can occur at any age. Calcific tendinitis can usually be treated by anti-inflammatories or injections. That's all for this video. If you enjoyed the video, consider liking and subscribing.